We've got one more minute, y'all, and we're going to jump right back in. Okay, hopefully you guys had a chance to get up and stretch your legs and get a glass of water. Welcome back. Okay, let's talk about dressing your baby. So, the golden rule in dressing your baby is to put them in one extra layer than what you need to feel comfortable. Now, this applies to any region that you live in, any climate, any time of year. You just need to look at whatever it is that you're wearing to feel comfortable and add a layer to your baby. So, an ideal outfit for a brand new baby would be something kind of cotton and simple, right? So, a onesie, this is a onesie, this is your very common base layer. This is your extra layer, right? So, this plus an outfit. There's a little footy pajama. And if I need a coat or something, I'm putting a sweater on top of all of this. So, some of you have probably been gifted really adorable but hilarious outfits for brand new babies that are like tights, dresses, jeans, suspenders, anything like that. Super cute. I mean, Christmas time is coming, but I would avoid any of those until your baby's at least a month old because they're full of seams and they're itchy. And if your baby's not happy, no one's happy, right? So, keep it really simple and basic. So anything that you've received for your baby secondhand or brand new out of the pack, go ahead and take those out of the packet and launder those in, you guessed it, fragrance-free hypoallergenic laundry detergent. No, there's not a brand that I feel loyal to, but you want to just keep it fragrance-free in case your baby's going to be sensitive to those detergents. Okay, let's dress the baby. All right, so I'm back to my stable surface that we diapered on. Okay, so and
You
I'm going to go
always
ahead
want to
and pick
wash
out
your
an
hands
outfit for
before and
her. I've
after
got
you
this
change
little
the diaper.
onesie
Super
here. Now, these
basic,
come
right?
in
But
packs
worth
of
mentioning.
three.
Normally, there's a long sleeve version of this, and there's also a sleeveless version of this. If you're kind of in a moderate climate like me, just get some short sleeve ones, and you'll be good. Okay, this little footy pajama I love because it's got a zipper on. It's super easy. It doesn't have 15 snaps that are going to make me cry at 3 a.m. because I'm tired and I can't get them to match. I love that there's a little footy piece here too, so that their feet are covered. This also has a fold over kind of mitt for babies so that if they're going to have long fingernails, they can't scratch their little faces. Okay, so whatever it is that I've picked out, I'm going to go ahead again and make my life easier and unsnap this onesie, lay it out flat, and unzip this guy and lay it out flat. Okay, so I've scooped her up just like we talked about earlier, and I'm just going to put her little onesie on first. So just like a t-shirt, just like you would put it on if you were the baby. So it can be hard at times to put a baby's arm in a sleeve because their tone is very naturally kind of flexed in like this. Okay. And so what I would always do with my kiddos is to cinch up the sleeve like you're putting on a pair of stockings, put your fingers through, and then at that point you can grab their little hand and pull their arm through. That's a lot easier, especially when it comes to long sleeved things. And I'm going to go ahead and snap this guy. There's usually just 2 snaps here. I'm going to scoop her up and just place her right on top of this sleeper. I'm going to do the arms first. And this is where that stocking trick is really going to help you because I got to cinch up this whole sleeve here. I'm going to put my fingers through. I'm going to grab her hand and pull that hand through. You can do it the other way. It's just going to take you a lot longer. Cinch it up, put your fingers through, and grab her hand. And then I'm going to put her little legs in. Zip it up. See how easy that was, right? When you're learning how to dress a baby for the first time, you don't want to be dealing with dresses and stockings and all that good stuff. You want to keep it very basic. And she's going to love this and sleep really good because it's nice and soft. Okay. I'm going to go ahead and show you how to swaddle a baby since we're here. This is just a good old fashioned swaddle. It's a blanket that has lots of holes in it so you can see me through. This is called a cellular blanket, and it's nice because it's very breathable and can be used for all seasons. So I'm going to take this cellular blanket here and fold down the top corner. See? And so this top corner, I'm just going to put down on my stable surface. I'm going to put her shoulders at the level of this triangle here. Let me show you. Well, see how this triangle is down like that? And this creates a pocket that I can stick her little hands in. Just a little trick. You're gonna roll this one side over like you're making a burrito, a really snug burrito. You're gonna put her other little hand through. Again, like a burrito. And she's swaddled. It looks a little weird because it's a doll, but she should be kind of tucked in like this. Notice that I'm not putting this blanket up past her shoulders and that her little hands are tucked in. Okay, and it's nice and snug. Swaddling is something that just takes time and practice. The nurses at the hospital are going to be pros at swaddling, so definitely get a lesson or two from them before you go home. So yeah, so we have a video on dressing and swaddling baby on our Instagram page. The Ireland account has a great swaddle video that I loved, so you might check that out too. And we're going to talk about safe sleep. So one of, I forget who, but somebody already knew about SIDS. So I'm happy that you guys already know about that. So this is the most, in my opinion, the most important topic that we talk about today because it concerns the safety of your baby. Okay, so SIDS is an acronym for sudden infant death syndrome. It is something that unfortunately happens still, despite all the research that we've done. We've been able to really reduce the incidence of SIDS very much by figuring out what risk factors there are for SIDS. Okay, so SIDS is basically when a baby passes away in their sleep and there's no other identified medical cause for that. All right, so we launched a back to sleep campaign in the early 90s, which means that we switched our advice from babies sleeping on their tummies to all babies sleeping on their backs since the early 90s. And since then, we've been able to reduce the number of SIDS deaths by 82%. So you can see with that significant number there how important it is always to put your baby on their back to sleep. Okay. So we have the ABCs of safe sleep here. So A stands for alone. Now what that means is you're going to put baby in their own sleep area by themselves. Okay. We don't recommend bed sharing with baby from a SID standpoint. That's not safe. All right. So you want to put her alone in her crib or bassinet, not with any stuffed animals or actual animals or their twin, right? Or you. So B again is on their back to sleep. Probably the most important risk factor there is being on their tummy. So C is a crib in your room. Now, this is a little bit newer research since I brought my first baby home from the hospital. So there was a very significant study that showed that the risk of SIDS we reduced the risk of SIDS by 50% when moms and babies shared a room together for the first 6 months. Okay. I know what you're thinking. You probably have a beautiful nursery or space for your baby that's all planned out, and you can certainly use that. But if you want to increase the odds that your baby's going to be as safe as possible, if you're able to kind of move that crib or have a little bassinet next to your bed in your bedroom for the first couple of months, first 6 months, then that would be the best thing that you can do. Okay. If you're not able to do that space wise, don't sweat it, right? But those are just the what the research tells us makes it as safe as possible. So D is don't fall asleep with your baby on the couch. I mean, that is such a tempting thing, right? There's nothing more delicious than snuggling with your new baby. And you can certainly do this kind of heart to heart business when you're awake and she can sleep all she wants, right? Because I'm supervising and I'm awake. But if I start to notice that I'm nodding off because I'm so blissed out, then look what can happen, right? So she can kind of slip out of my arms and get in between the cushions of the sofa or something and get herself into trouble, okay? You're a little bit sleep deprived as a parent. So just know if you're starting to kind of nod off, go ahead and put her down in that safe sleep area and go lay down yourself. So E stands for early medical advice if your baby seems unwell. Well, that seems very vague, doesn't it? So, what does that mean? So, if baby's not well, they don't have good tone, right? This tone that I keep talking about, a baby who's floppy is not okay, and you need to reach out to the pediatrician. A baby who is sleeping all of the time and not wanting to get up every couple of hours to feed is not well. A baby who's fevering is not well. A baby who's blue in the face or the trunk is not well. Or if you just feel like something isn't quite right with baby, I know that sounds very vague, but there's this thing inside of every parent called your intuition. And you want to listen to that, okay? And honor that and always pick up the phone. Okay, so F stands for forget about smoking in the same room as your baby. Smoking is a huge risk factor for SIDS. Okay, so we really encourage you to try to stop smoking if you can. If you must smoke, then please go outside of your living space and do that outdoors with different clothing on, gloves on your hands. You don't want to transfer that smell to baby. And keep in mind, as a smoker, your sense of smell is not as refined, right? So, no smoking around baby. G is get rid of any soft objects or anything loose or fluffy. So that kind of goes back to the baby alone on their back in the crib. You don't want them to have any opportunity to go up against something plush like a teddy bear or another blanket because they're not able to breathe, right? If they're up against anything plush or loose or fluffy. So I know you probably have a lot of beautiful stuffed animals and things and blankets and loveys. And I promise you, you're going to get tons of use out of those items when your baby's a little bit older and actually cares about those things, right? So when they're brand new, they don't care about that kind of stuff, right? And you want to just keep them as safe as possible. So there is a video on safe sleep for twins. If I missed any twins in the house, I apologize. There are a lot of you here this morning, but there is a video that I did about twins on our Instagram page. But the cliff notes are the American Academy of Pediatrics wants you to put them in separate sleep areas, also on their back to sleep. Okay, so this graphic hopefully is helpful to kind of summarize what the best sleep environment should look like for your baby. So keep in mind that SIDS happens more often in the winter months. The peak incidence of SIDS is around 2 months along. Once your baby gets to 6 months old, then the incidence of SIDS goes down by a lot, right? So you want to be on guard for the first 6 months, I would say, 4 to 6 months. All right. So you want to make sure that if that crib is tucked into your bedroom, you want to make sure that it's not parked next to any blinds or cords hanging down because once baby gets a little older and gets more mobile, they can get themselves into trouble with that. All right. Again, no smoking near your baby or around your baby in that home. You want to use so no pillows, blankets, sheepskins, bumper pads. Really don't need those bumper pads, you guys. And those are still considered to be plush items. All right. And so this is super Spartan and super minimal, and that's the name of the game, y'all. Okay. And so this mattress is a firm mattress in a safety approved crib. I was very surprised when I shopped for my first baby, despite all of my work experience, how firm all of these mattresses are. It's like you could bounce a quarter off these mattresses. They're so firm, but that's really what we want. You don't want a pillow top for a baby because you don't want that plush. Yeah. That baby's on his back to sleep. He doesn't have a hat covering his head. Hats sometimes can be oversized and can go down over the face. Yeah. So no hat, even if it's chilly. You got them bundled elsewhere. This he's wearing some sleep clothing now. What that means is sleep clothing is this thing called a sleep sack. A sleep sack is a wearable blanket. It has a zipper here, and the arms go in here. And so once your baby gets a little bit older and they're rolling around, you want to transition them from a tight swaddle at around 2 months to this sleep sack here. And this is cool because that way the baby can be covered with a blanket, but they can't kick the blanket up over their face. Okay. Baby's on their back to sleep. And then the slots of this crib here are 2 3/8 inches apart. All cribs on the market should have that specification. You just want to make sure that baby doesn't have the opportunity to get their head or their little arm stuck in between the crib. Okay. And then a crib sheet. So yeah, so no blankets, no top sheet like we would have, no pillow top, no pillows. All right. So you want to do a firm mattress, a fitted sheet. I would have definitely an extra fitted sheet on hand all the time in case your baby throws up on the sheets and you need to change it in the middle of the night. You have that available to you. That said, they do these plastic mattress covers that are very helpful as well. So that protects the mattress from any accidents that happen on the mattress. So for a mattress pad or mattress cover that's plastic, and then a fitted sheet over. Yeah, so this slide I it seems confusing at times when I teach this class because it says that swaddling is only okay for daytime sleeping. But I think that if you have a tight swaddle like so, or you have the swaddle blankets with the Velcro attached, so it's a nice tight swaddle, then you can certainly put baby down to sleep on her back like this for the first 2 months. The deal with 2 months is that when they're 2 months old, a normal baby will be rolling over. And once she has the ability to roll over on her tummy, I want her to have the ability to move herself back. Yeah. And so when she has this sleep sack on, her arms are free, and if she's going to roll over, she can move herself back on her back if she wants to. Okay. Now you could put the baby in a sleep sack from the beginning. However, in my experience, if you think about where your babies are in the womb now, they're really compact and to fit in that space. Yeah. And so you really want to simulate that kind of tucked in feeling. Babies feel more safe and secure when they are tucked in, like they're in the womb, and they sleep better that way. So, yeah, so you want to make sure if you have one of those fancy swaddles with the Velcro attached that it's just at the top. You don't want to do a super tight Velcro at the hips because that can cause a little bit of hip dysplasia if you really constrict those hips. So you want to just at the top have it nice and snug. And you want to keep baby's shoulders, head, and neck free, like when we swaddled her not long ago. So her head's free so that if she turns her head, she doesn't go up against any fabric. So yeah, so this is the big take home. Once baby can roll at around 2 months, once they can roll over, then you shouldn't swaddle them. You should put them into sleep sacks. Okay. You just don't want them to get tangled up in their own covers. So the things that we don't recommend from a SID standpoint, I think the biggest point that I'll make here on this slide is the pillow, right? I know a lot of y'all are probably thinking, what, they can't have a pillow? Like, can't she have a pillow to sleep? So pillows are very plush and increase the risk of SIDS for your baby, okay? You don't want to, I know there's people will ask about a flat head. What if she gets a flat head? So the answer to that is this practice called tummy time. You can start tummy time when the baby's a few weeks old. And that is when you put baby on her tummy. It's like a little exercise for baby every day. So pretend there's a big blanket here. You have her on a blanket and she doesn't have good neck muscles or head control early on. So her head's going to hang down initially, but she's going to get to a space where she starts to pick up her head. Yeah. And so if I'm doing tummy time a couple of minutes every day, then guess what I'm doing? I'm helping her have her own head control so that she can independently turn her head from side to side so she doesn't get a flat head on that flat mattress. Hopefully that makes sense. So yeah, so no pillows,
No going to sleep in this boppy here. This DockATot boppy lounger, I want to say was recalled a couple of months ago for this very reason. You don't want to put baby to sleep in this very plush item unattended because it's just too plush. They can also roll off of it too. Okay. This hammock looks cozy. However, as whatever size baby is going to kind of go to the center of the hammock, and they're going to flex their little chin to the chest and not be able to have a clear airway. So you want baby flat and not at the bottom of the hammock. Okay. This bumper pad here is considered to be too plush. You could do a mesh one if you must, or just wait until they're 6 months old and pop one on. This wedge here is still a plush item, and baby's going to. The other common question I get is, what if the baby spits up? And aren't they going to choke on their own spit up if they're on their back to sleep? Which is a totally fair question, but just hear me out. So before you put them down to sleep, you're feeding them, right? And so every time you feed your baby, you need to burp them. Okay. And so when I fed her and she's satisfied and she's wanting to go to sleep, I'm still going to burp this kid. Okay. I'm going to throw her over my shoulder and give her lots of pats. Do you hear how loud this is? Babies like this. Okay. And I'm going to pat her until she gets that air bubble that might be in her tummy out. And any big spit ups that this kid is going to have is going to happen in this space. And so if I get a good feed and a good burp in, then I know that when I put her down on her back to sleep, she's not going to spit up much. And if she does at all, it's just going to be a little bit that goes down her cheek. Okay. Okay, so this slide here illustrates the point of, looking at one extra layer than what you need to feel comfortable. TOG it's not really an American thing. TOG is the weight of fabric used. So this would be like muslin, and this would be heavy cotton, maybe even fleece. Although I don't love it when babies have fleece on. I think it overheats babies when they wear fleece. But basically, you want to it's common sense, I think, right? So appropriate clothes for the season plus an extra layer. Okay, so if you guys are feeling overwhelmed or confused by the temperature thing, then just know that if you're ever in doubt about what kind of environment you've set up for baby, if it's good or not, you can always just take their temperature and see how you did. Yeah, so baby's always in one extra layer than what you need to feel comfortable. The weight of fabric is appropriate for the season. So this is like a summer fabric, just to illustrate a point. It's called muslin. It's pretty mainstream. I like it. This was a good. I use this swaddle for my winter babies. It's not fleece. It is cotton, but it's a tight weave and a heavy cotton and nice and toasty warm for baby, but not too warm. And this is your kind of middle of the road blanket. This cellular blanket with the holes in it is a nice breathable blanket. And just know too that these sleep sacks or these wearable blankets come in all sizes and types of fabric. This happens to be a muslin wearable blanket, but they also have heavier wearable blankets, like a heavier cotton. So if you're going to go check out your baby and see if the baby's too warm or too cold, then just keep in mind that if you just check their little hand or their foot, that's not going to tell you what their temperature actually is, because their babies always have colder hands and feet, because these areas of the body are not a priority to perfuse with blood, right? We're working on perfusing these vital organs here, and this is secondary. So they're going to have chilly hands and feet, and that's okay. Their noses are going to be cold too, and that's very normal for a baby. Now, if you wanted to check their actual core temperature, you're going to put your hand on their chest, and that will give you a better idea. Yeah, so if you're concerned, go ahead and grab your thermometer. All of you guys should have a thermometer in your home before you bring your baby home. This is a super basic digital thermometer. I like it because it's got I don't even know if they do non-digital thermometers nowadays, but this tip here You can't do oral temperature on a newborn baby, right? Because they can't keep their mouth closed. You could do under the armpit here. You just want to make sure that the tip is actually like in their pit and not out the other side. Okay. This under the armpit temperature is not the most accurate way to take a temperature. I would say add a degree to this if you're going to do it this way. You could also do the across the forehead thermometers. The infrared ones are fine too. I don't love the ear ones. If you want to do the fancy newer ones, I would just do across the forehead ones. Or you could do a rectal temperature. That's really the most accurate way to take a baby's temperature is actually a rectal temp, and that would be with this type of thermometer. If you feel comfortable, it's something you could do at home. So, say I'm worried the baby has a fever, right? And I call the pediatrician and they say, hey, well, can you check a rectal temperature, right? So I'm just going to pretend she's undressed. I'm going to undress her, stick her on my lap like this, and then put some KY jelly on the tip here and just slide it in to her bottom, not very far, just to the point where the numbers start to read. If you meet any resistance, you've gone too far. Yeah. And that's how you take a rectal temperature. So the normal range is 97.7 to 99.5. So you might find that if your baby's a little underdressed, their skin might be a little bit mottled or blotchy. They might be a little bit fussy. You take their temperature, say they're 97.0, 97.1. Don't panic. They're just a little underdressed. It's okay. If your baby is very cold, like 96 and fussy, the quickest way to warm up a baby who's cold is to actually get her undressed and put her on your bare chest and then put a blanket over the two of you guys. Your body heat is going to warm up baby faster. Okay. On the other end of the spectrum, if baby's too hot and they're a little fussy and you take their temperature and they're 99.8, doesn't necessarily mean they have a fever. It could just be that they're a little overdressed. Yeah. Maybe the blanket's too heavy. Maybe they have a hat on. Maybe they got fleece on, right? So just remove a one layer of clothing or a hat or something and give it about a half hour, check again. And if it comes down, then you got your answer. Okay, 97.7 to 99.5. The other piece too that I wish was on this slide is I get the question a lot of what should my thermostat be set on from a SID standpoint? What's the safest temperature to put my thermostat on? It needs to be 68 to 72 degrees. That's the read on your AC or your heat. 68 to 72 degrees. Okay, so what happens before you leave the hospital? So, if any of you are delivering in a birthing center or at home, attended by a midwife, just know that these things will be done or should be offered to you or to your baby. They're just done in a different way. Okay, but we're going to talk about hospital stuff because that's the majority of babies in the US. So, your baby's going to get their weight checked. Obviously, the birth weight is going to happen when they're first born. We completely expect for your baby to lose weight in the first couple of days. It's very normal, yeah, because they're not eating a whole lot. We just don't want them to lose more than 10% of their birth weight. Okay, if they're losing more than 10% of their birth weight while they're in the hospital, we know that they might need to be supplemented a little bit with more breastfeeding or express breast milk or formula, right? So they're going to be weighing your baby every day. An audiologist or a hearing specialist is going to come by and check your baby's hearing with these little probes that they put in the ears. It's quick and painless and something that they'll do before you're discharged from the hospital. Okay. So these two bullets here, these are blood tests. The bilirubin check and the PKU newborn screening test. Now, these are blood tests. Bilirubin will check for jaundice or yellowing of the skin, and this newborn screening test is a screening test for a bunch of metabolic disorders. Okay, so your baby does not get their blood drawn like you or I get our blood drawn. You're not going to stick a vein in the arm or anything for those tests. They're going to actually do a heel stick, which is basically getting little drops of blood so that they can check those things. Yeah, so the newborn screening test should be done at around 36 hours of life, which is when you start to kind of get home from be released from the hospital. And average length of stay for a vaginal delivery in a hospital setting should be 2 days. Okay. And so, where I practice, the pediatricians are happy to release baby home with mom at around 36 hours, sometimes 48 hours. If you're having a C section, you're probably going to be going home at 3 or 4 days after the birth. Okay. So the postpartum nurse is actually going to do the test before you go home, and she's going to do that heel stick that I was talking about. So, if any of you have ever taken your blood sugar, I'm sure you all have, right? You use those little lancets to kind of prick the tip of your finger pad, and then you squeeze a little bit of blood and you check your blood sugar. It's the same exact concept for baby, except we're sticking their heel, which is a bit juicier and easier to get blood from. Okay. So, they're going to use the same kind of little lancet to put a little hole in the heel that clots really quickly, and there's just going to be little tiny drops of blood, and that's how we get the newborn screening test. Okay, so the newborn screening test does vary from state to state, but there are a handful of metabolic disorders that are universal to all states. So we're going to be screening baby for conditions like cystic fibrosis, galactosemia, sickle cell, congenital hypothyroidism, etc. Okay. And it's really important that your baby get this test done, because if your baby is a carrier for one of these conditions, they're not going to show you that they have symptoms of that disorder for a while, and it's so much better for them outcome wise to know this early on so that we can have early intervention. So this is what a newborn screening form looks like. So the nurse is going to put your baby's vital info here, and then they're going to do a little heel stick on baby and actually put that piece of paper up to the baby's heel and paint these little circles here with blood. And it looks like you need a lot more blood than what you actually need. So really, I know a lot of you are thinking, I don't want my baby to get their blood drawn, but it's completely for necessary for their safety, yeah, before they go home. And it can be done really easily and very smoothly. And that's done when that baby's feet, their little heel is nice and warm. A warm heel is going to bleed nice and easy for you so that you can get that lab test and move on, right? Cold foot, you're going to have to squeeze a lot more because that blood, to get the blood flow to come out on your newborn screening test. So put some socks on the baby, put a little, sometimes they have heel warmers that you can pop and put on baby's heel, and that will help that test go a lot smoother. So I think the best way, if you're going to do this test, is to actually have the nurse come and sit on the bed next to you, right? So I know, it's 36 hours along. I'm wanting to go home. We got to do that newborn screening test. I've done such a good swaddle, I can't find her heel. She's got some socks on. She has a heel warmer here. She's got a toasty warm heel. Hey, she might even be on the breast. She might even be actively feeding. And so the postpartum nurse is going to sit here and do a little stick and a squeeze and get that test done. Guess what? She's going to keep feeding and not even cry. When it's set up like this, these kids do not even cry. It's very it's they're still calm, right? And so this is the best setup, I think. All right. And so the newborn screening test, those results are going to be sent to your pediatrician. You're not going to know the results of those tests before you go home. They're going to mail that out to your PD, which is why you should have a pediatrician selected before you go to the hospital. Okay, so today we talked about all things baby care. We did not talk about breastfeeding, but we can talk about that later. We talked about bathing your baby, changing diapers, skin and nail care, cord care, SIDS, dressing your baby, temperature control. Okay. There are so many other things that we feel like you need to know as new parents, you guys. Even if you're having a high risk pregnancy and you're planning maybe a C section at the end, or you're going to get delivered a little early, all of this stuff still applies to you. Okay. So these other 4 pillars that I mentioned earlier are covered in a full 1 day online childbirth class. Okay. So we talk about signs to know when you're in labor, right? How do I know I'm actually in labor? What happens during the stages of labor? What about ways to cope, right? We talk about epidurals, but we also talk about what positions you might get in or what strategies you might use to kind of get through the intensity of those contractions without medication, if that's your goal. We tell you what to put in your hospital bag, super practical stuff. We tell you about birthing positions, pushing positions, what your partner can do to help you in that space. We talk about C sections too. We talk about if your baby needs a little help with the vaginal delivery with vacuum or forceps, we'll cover that as well. We do talk about inductions too. What happens right after a baby's born, skin to skin. We talk about delayed cord clamping. And then your first 100 days as parents. I love this. When I was pregnant, I was so laser focused on the day of getting through labor, right? And getting that baby out, that when I took the baby home, despite all my professional experience, was like, overwhelming, right? So we've got you covered in that aspect. So we talk about going home from the hospital. We talk about postpartum depression, changes in your body, changes in your breasts, how to know when your baby's hungry and needs to eat. We talk about breastfeeding and ways to get a good latch. Yeah. We also talk about formula feeding and how to supplement. And we talk about burping baby, vitamin D supplementation, and ways to bond with baby. And then choking and CPR, baby proofing your house, and how to kind of respond in those emergency situations. So this slide illustrates a point, as all slides do, that there are really two types of people in all things who go towards an unknown thing, a big thing, and they'd rather just white knuckle it and know nothing. And there are those who would rather just be prepared and find out as much as they can about that unknown thing so that when they reach that labor or that big event, they know what to do, right? They know what questions to ask. So, childbirth education is the most important thing that you will do to have a smooth labor, right? Our culture does so much to scare us about birth, right? I see the movie version of labor and it doesn't look like that, you guys. And it also doesn't have to be terrifying. I understand if it feels scary to you. I felt that too, right? But you can meet that fear with preparing yourself, with preparation. And if you know what to actually expect beyond what the movies tell you, then you know what questions to ask when you're in that space. You know how to make decisions with your healthcare provider. You know what to tell your nurse, what your preferences are, right? And you will have a more active role in your own care. We really want you to be autonomous in how things go in the course of your labor. That's super important, right? So childbirth education is the way that you can get that. So don't just take my word for it, right? Even though I see it every day at work, but there are health benefits to taking childbirth classes. You're going to have better outcomes if you do a little bit of prep before. Okay. And so this stat tells us that 80% of women have some kind of mood change after they deliver. It's very, very common. I think our culture is really kind of moving in the right direction in terms of normalizing or, bringing out into the open mood disorders, depression, anxiety. These are realities, right? They're not reflections of what kind of parent you are or what kind of person you are. These are just things that could happen or not, right? We want you to be able to recognize those things so that you can get some help, right? I don't want you to look back on the first year of being a parent and realizing at 1 year that you had postpartum depression. I want you to enjoy your baby when you are in that moment, right? So if you're planning to breastfeed your baby, then you should do a childbirth class, right? Because that will increase the odds that you're going to be able to actually do that. Okay. So if you're able to exclusively breastfeed your baby, there are health benefits to baby, many, many benefits, but also for you will reduce the risk of type 2 diabetes, breast and ovarian cancer. And if you're prepared for that untoward incident of choking CPR, then you're ready, right? I hope none of you ever encounter that, but always good to know what to do. So you're less likely to have a problematic labor or birth experience. I see this in real life at work every day, right? I want a healthy mama, healthy baby, but I want more than that. I want you to have a good experience. I want you to know what's going on all of the time so that you can look back on it and feel like you had some autonomy. Yeah. I want you to have a good experience, and childbirth classes are the way to do that. If you are planning to go au naturel in labor, you got to do a class. That will increase your odds. Okay. It is really hard to wing it without drugs in labor unless you've made a lot of plans in preparation for that. So I love the Baby Academy. I mean, obviously, I love childbirth education, but I love that we are all midwife-led organization. All of us are in practice in real life. A lot of us are moms too, so we really bring that kind of practical element to birthing and parenting. I hope that you saw some of that today, right? And hopefully, we don't preach to you guys. I know that real life doesn't always look like the textbooks. So my job is to give you the what I know from my experiences, but also all of my training, and you can decide what works for you. So, if you sign in with our 1 day childbirth class, then you're going to get access to a lot of other things that we offer too. So, we have a whole resource hub, and there's a lot of content there from our experts so that it's like a one stop shop for you if you have questions, right? So, a lot of us ask Dr. Google questions, and Dr. Google can tell us anything that we want to hear, but can also be very scary. So, I want you to have a space to go that's vetted with reputable information for all of your questions. And the Baby Academy has a great hub for that. So this class has a ton of information, you guys. It's very hard to retain that info in just 1 day. So it is recorded, and you can watch that back or listen to that back for 6 months after the class. So you can kind of digest that information as you kind of go back to it. All right. So we get some good reviews from you guys too. We got a lot of 5-star reviews. Thank you for those. So the 1 day class, again, is really tailored for first time expectant parents. So no need to feel intimidated. You don't have to know anything about birth or babies to get everything you need from this course. The best time to come is any time in the second or third trimester, so the end of your pregnancy. So that's 28 weeks and beyond. So if you want to map out when y'all are in the early 30 some odd weeks of pregnancy, that would really be the best time to take this class, because you have time to kind of listen back and digest the information. I don't want you to book it when you're 38 weeks along. You may have already delivered by then. So yes, so you'll get a recording of the class so you can watch it back. If you're not really an audio learner and more of a visual learner, you can watch it back too. And you'll get access to our resource page. So those of you guys with an HSA or a flex spending account, you can use that account to pay for the class. So it's 179 a couple for all of that information. I think that's a bargain, y'all, based on the other classes that I see out there. I feel really proud that we can offer this at an affordable rate for you guys. Oh my gosh, there's a $50 coupon code. So it's 129 a couple. It's like Black Friday vibes. So you get it for even more affordable, 129 a couple if you book today. So go ahead and grab your class. So these classes are done on Saturdays, and they last all day, right? And it looks like there's only one place on these upcoming classes here. That one already passed. Um, you can book your class by pressing this little red button here and go ahead and grab that. We used to offer classes more often, so looks like those would fill up fast if there's just one a month. So I would go ahead and book that class as soon as you can. I really hope that we see you again, or I hope that you guys all get childbirth education somewhere. I promise you it will really help your experience. Thank you so much for spending part of your Saturday with me. I hope that you learned something today. I really appreciate your attention and your patience with our little tech snafu. Um, Thanks, y'all. So there is time for a little bit of questions. Yeah, so we have about 7 minutes to cover any other lingering questions that y'all have. All right. You guys are so nice. Thank you. Thanks, Kara. Thanks, Minnie. I need readers now. Y'all's names are so small. Thanks, Jennifer. She writes, I've been caring for children for many years and I've learned a lot today. First time mom. Thank you. You know what, Jennifer? I find that even if you do this stuff for a living, it's different when it's you and it's your baby. There's a certain vulnerability there that education will certainly help for sure. Yeah. Oh, good. Well, we're going to see you again, Elizabeth. Thank you. Thanks, Hillary. Okay, Elizabeth, she's got a question. So, when using a sleep sack, do you just dress the baby like normal underneath it? Yeah, for sure. So, it's a sleep sack is a glorified blanket. Okay, so you're gonna dress baby in that like onesie sleeper, and then instead of a swaddle, you're gonna do a sleep sack. Yeah, good question. Kara, when do we introduce bumpers into the crib, and are they necessary? So, Kara, I really don't. This is my mom advice speaking here. You don't need bumpers. I think they provide, I don't know why I even did bumpers with my kids. Maybe it's like an aesthetic thing or something you think you need, but you really don't. Because if you think about, bear with me with my logic here. If you have a crib that's got the right distance between the bars, baby can't get their little arm or leg stuck in between. They can't get their head stuck in between. So you're safe from that aspect, right? They only increase your risk of SIDS if you do a bumper early on, especially if it's plush. And when your baby gets more mobile and is standing up with their arms on the bars and wanting you to like come in and pick them up, guess what? They can step on the bumper and get out of the crib easier by stepping on the bumper. I had one little escape artist in my house that did that. So, no, they're not necessary. Thanks, Jennifer. Thanks, Brittany. Thank you, Gina. Elizabeth, I don't know if I'm going to be teaching the class or not. We have not booked that far our own personal schedules, but you very well may see me. Yeah. I hope I see you again. And, all of my partners are fabulous too. You're going to have a great experience. Thanks, Jasmine. Y'all are so nice. Okay, more questions. If they fall asleep in a bouncer or swing, is that okay? Should you move them to the crib? Really good question. So, yeah, Bridget, if you are supervising, if you're around and you have eyes on them, you can keep them there. But I will say it gets really tempting to keep them in the swing for hours and hours. So if you know that you're going to go lay down too, or you're going to go another room and do something, then I would just once they're asleep, just scoop them up and put them on that on their in their crib. Yeah, because bouncers and swings can be very plush at times. Okay, so Yuma, can you discuss layering again? For sure. If it's winter for sleep, do we put a onesie and then a sleep blanket? Yeah. So okay, it's winter time right now. I have on a pair of scrubs. So I know that my baby needs an extra layer. She needs a full on onesie underneath, yeah, plus a sleeper. So I've got her in the winter, I've got her in like a cotton or a fabric that's appropriate for this season, right? I'm not putting her in muslin fabric or linen fabric. I'm putting her in a thicker fabric, right? And so she, for winter time, if I'm putting her down to sleep, she's got this base layer, this onesie. She's got this long sleeve sleeper here. And because it's winter time, I'm going to put her in this blanket. This was my wintertime blanket for my kids, and I love it because it's cotton, but it's a nice tight weave and it's heavier. Okay. So I'm going to swaddle this little sweetheart in a thicker blanket just because of the season. Because when I look on my bed, I have a heavy duvet on my bed, which is unique to the season. Does that help? So one extra layer than you need. Sabra, how and when to shave baby? I'm not sure I know what you mean by that, Sabra, about shaving baby. That might be a cultural thing, and I don't know that I can speak to that. Yeah. Again, that really falls into the category of doing what suits you and your values and your lifestyle, right? Doing the best you can with the information that you have. Okay. Brianna, what about Tide powder laundry for baby clothes? Yeah, Brianna, our recommendations are the hypoallergenic fragrance free, but you can try a normal laundry detergent and see, if your baby breaks out into a rash or they have any skin sensitivity, redness, or any rash after you launder with Tide, then that's your answer that it's too much for them. But could be just fine. I laundered my kids' clothes in just normal Dreft. Yeah. Jessica, are fans safe to use while baby's in the room sleeping in the bassinet? Yeah, fans are totally safe, Jessica. I get that question a lot. Fans are good. I would just be careful about stand up heaters or radiators in the wintertime. You just want to make sure that baby's not overheating. Okay. You don't want it too hot in there. Again, that thermostat needs to be 68 to 72 degrees. Okay. Angelina, vitamin K shot and hepatitis B shot after birth. What are your thoughts? Oh, girl, you're going for it. I love it. Okay, so the vitamin K shot, you guys, is a standard newborn medication that is offered within 2 hours of their life. I think that it is necessary for all babies. It is your choice as a parent to do the shot or not do the shot, but I'll tell you why you need it. Vitamin K is something that is deficient in newborn babies. Vitamin K is a mineral that helps you clot your blood. And if you supplement them with a vitamin K shot, then they'll have those blood clotting capabilities. What vitamin K does is it protects baby from this rare thing called a brain bleed, hemorrhagic disease of the newborn. Okay. And so I definitely recommend vitamin K shots within 2 hours of life, right? You Most of the shots I've seen in the hospital system are preservative free, but you can ask if you're concerned about preservatives, you can ask for the preservative free version. Now, that said, hepatitis B, I think so. You're getting my opinion on this. Hepatitis B shots are routinely given to newborns before they go home from the hospital. But you have to consider what your risk for baby's exposure to hepatitis B actually is. You might consider too that the hepatitis B shot could be given at another time when they're getting their 2 month immunizations. So I'll just tell you, mom to mom, what I did. I do vaccinate my children. I did do the vitamin K shot for my kids, even when I had a home birth in the bathtub. I'm crunchy, and I did the vitamin K shot because I'm a NICU nurse too. Okay. I didn't do the hepatitis B shot. I kept that for the 2 month shots. Okay. Hopefully that's helpful. Hillary, safe sleep question. What if the baby is unable to sleep on the back due to reflux? Really valid question, Hillary. Thank you. Again, I'll just kind of re-emphasize the importance of burping your baby after they've fed, always, always. And so you're going to get that big spit up or that big air bubble out during this burping time and not when they're on their back to sleep. Now, that said, if your baby has severe reflux, your baby's going to be a little bit older and your pediatrician is going to be working with you. Your pediatrician might recommend a wedge or inclining the crib a bit. But that is a very specialized thing, kind of tailored to your specific baby and what your pediatrician recommends. But in general, for all babies, I recommend just on their back to sleep. There is a whole body of evidence to support that that is safer for all babies, for SIDS. Okay, hopefully that's helpful. Right. Thanks, y'all. Oh, Hannah, I always get this delayed cord clamping question, and I'm surprised I'm just now getting it. So Hannah writes, I've heard about delayed cord clamping. Is this really necessary? Okay, y'all. So delayed cord clamping is a practice where, remember when we were talking about cord care and this highway of blood, oxygen, and nutrients from the placenta to baby? Okay, she's born, she's crying, she's breathing, but guess what? This is still pulsating until someone puts that clamp on. So if I delay putting the clamp on by a few minutes, she gets an extra bit of blood from her own placenta. And so I do support delayed cord clamping. I do that in my daily practice as a baby catcher. I think that the benefits are
not just me thinking, the research tells us the benefits are your baby will receive an extra 300 milliliters of blood from their own placenta back to their body. And that's good because that will help perfuse those vital organs, brain, heart, lungs. Yeah. And will reduce the risk of iron deficiency anemia at 6 months of life. So it's definitely a beneficial practice. Okay. And so that's basically once this cord stops pulsating, mean it's the flow of blood, you can actually feel the cord pulsating. So when your baby catcher baby comes out and you want to delay cord clamping, it only takes a couple of minutes, y'all, for this to stop pulsating. And once it does, then they're going to put a clamp on and you can cut that cord. Okay. I think it's super beneficial. It's called delayed cord clamping. It's something you want to look into, talk to your provider about, and put on your in your birthing plan, which is a one-page document you can create to tell people about your birth preferences. Okay. Okay, Lacey, should you use a crib liner instead of a crib bumper? Thanks so much for today. You're welcome, Lacey. I don't think you need any crib bumpers, Lacey. I hope I'm saying your name right. On your crib, what I recommend is that kind of plastic mattress cover to protect the mattress and a fitted sheet. That's it. Okay. Um, and you want to have an extra fitted sheet on hand so that you can change it in the middle of the night if you need to. Okay, Lauren. Yeah. So I'm sorry for the confusion about swaddling. I feel like that slide is a little confusing. So she writes, do we not swaddle baby at night at all? Okay, Lauren. So when the baby's new for the first 2 months, they can't roll over, right? And so if you have a nice tight swaddle, but you got to have a nice tight swaddle. Yeah. Good burrito. You can put her down to sleep day and night like this until she starts to roll over. Okay. So swaddles are good day and night. And then once she starts to roll over, you can put her in a sack. Okay. The reason why I push back on what that slide says is because babies like to they feel more safe and secure when they're snug in a swaddle. Okay. If you have a brand new baby and you're putting them down and they're like out in the breeze, they might not sleep as good. They don't feel safe, right? Those have been my observations over the last 2 decades. So thanks, Jessica. Thank you guys. Kristen, can we use fabric softener when washing baby clothes? Yeah, for sure. Yeah, just keep an eye if you do any new products on baby, keep an eye on their skin and make sure there's no sensitivities there. And if you don't see any difference in their skin, then you can do what you do. Shauna, any need to clean inside the baby's ears during the early stage of life? Thank you for asking that. No. Resist the urge to put a Q-tip inside your ear. Okay. Anything that you can clean with your finger and a wash rag is cool. Anything beyond that, you don't want to go digging in because what you do is you actually create more of an obstruction or impaction of wax. So any extra wax that needs to come out is going to come out. You just don't go digging in there. Brianna, I also know the Owlet is not FDA approved, but what are your views on it? Yeah, Brianna, so the Owlet is an electronic sock that measures your baby's kind of oxygenation and breathing overnight. It's connected to your phone and it alarms if baby's not doing well. That's the idea behind it. I don't, Brianna, feel that it is necessary for a healthy baby. I know that it is not proven to reduce the risk of SIDS. Okay. That said, if you feel like you need an outlet sock to feel more comfortable and to feel more secure, then do it. Right. If you have the resources to do it, then that's fine. Right. But just, I don't want you, Brianna, to let your guard down and not do the other recommendations for SIDS. Right. The only issue I have with these companies that kind of indirectly claim to protect a baby from SIDS is you let your guard down, right? You're like, oh, well, I have the outlet, so she can have her lovey and she can be on her tummy and all this. I want you to still do all the things, and you can add the outlet if you want, but I don't think you need it. I think you can save your money.
You can, yeah, swaddle the baby when they're sleeping. That's, it just depends on the baby. But yeah, when you put them down to sleep, you want to swaddle them. Gina, should you still put a onesie under a micro fleece sleep sack? I would. I would just do a one a onesie with long sleeves. And that said, Gina, I would, when you do it for the first time, if you have any doubts about overheating baby, remember, go ahead and check their temp on their chest or even like grab a temperature here and you'll know. Okay. Tiffany, do you recommend a bedside bassinet? Yeah, Tiffany, I think those are great for the first couple of months. You know, when they're rolling over at 2 months, then it's not an appropriate thing for them. It's not as safe for them. But I love a bassinet because it means you can put it right next to your bed in your room. And it's more convenient for you. When baby gets up, you can just pop her on the breast or do whatever you need to do without getting out of your bed sometimes. Yeah, bedside bassinets are great. Those little arms reach co-sleepers is a separate sleep area for your baby, but you're not sharing a bed with them. I think those are fabulous. Kanisha, how soon do you start doing tummy time? Yeah, so it just depends on your baby, Kanisha. But I thank you for asking that. Tummy time is so important, you guys. It just helps your baby's neck muscles get strong fast so that they can turn their head when they spit up. They can turn their head and not get a flat head. Okay, so you can do that whenever. I would say 2 weeks. I started doing tummy time with my girls when they were about 2 weeks along 2 weeks old. And I would do it during a time of day where they seemed quiet, alert, right? They weren't hungry, they weren't dirty, they weren't grouchy, they were just kind of looking around, being cute, right? Would catch them in that moment and then put them on a big pillow. And you're just going to start out with a couple of minutes, okay? So pretend that this diaper pack is a pillow, y'all. Okay, so at first, her neck's gonna be kind of hanging down, but she's alert and happy. So she's gonna be like, okay, what does it feel like for me to lift my head? And she's gonna try a couple times. And then when she gets tired, she's gonna fuss. And that's when you say, hey, great job, baby. Let's do it again tomorrow. If it's a minute, cool. You can do 2 minutes tomorrow, right? So just slow chunks. And before you know it, she's gonna be up like a cobra, loving life and tummy time. And they're gonna have a strong baby. Okay, I have a question. Do you recommend getting the baby a scratch test before they leave the hospital? I can you specify in the chat? I don't know what you mean by a scratch test. I'm sorry. Krishna, I know a boppy or a DockATot is not recommended due to SIDS. What can be used to lay the baby down during the day instead? Yeah, so you can lay them down on a boppy or a DockATot if you are right there supervising. Yeah, you're doing some emails and she's on the boppy and you're there. That's okay, right? But during the day, if she's sleeping, put her in her crib. Okay. And you can use that boppy or DockATot for tummy time. That's a good thing to do. But just resist the urge to keep her unattended sleeping there. Okay. Yay. Thanks, Katie. We'll see you again. Okay, Sadie, what about bassinets instead of a crib in the room? Thank you. Yeah, Sadie, bassinets are certainly smaller than cribs, so you can do that for the first 2 months, and that will decrease the risk of SIDS, and that'll be a nice temporary thing for you. Or you could just put your crib in there if you have the space. Yeah, that sounds fine. Um, Okay, quick question on a swaddle. When you tuck one side underneath the baby, it's not smooth there. Will you impact the baby's back or sleeping? The short answer is no. You will not impact the baby's back or sleeping. But I'm going to guess that based on that question, you're going to be an expert swaddler. I know, just know it. So you can make it smooth underneath. You can make it smooth. You'll find your way with swaddling. You're going to have like a perfect burrito swaddle. Love it. Okay, thanks y'all so much. Have a great holiday season. Stay safe out there. Enjoy your time with your babies. It is such a fun ride. I'm super excited for y'all, and we'll see you again soon. Have a great day.